Hello, everyone. I welcome you to another lesson where we are looking at small for dates or small for gestation age for the baby, okay, or light for date. Okay, my names are Jones HM. Okay, so those are my names. Okay, so our topic for today is small for dates and large for dates. So our definition for small for dates or small for gestation age, um, by definition, small for date, this is an infant who is born at the right gestation period but with low birth weight. Despite their size, a small for gestation age baby usually appear and behave much like normal infants. These infants have reached full term and has fully developed internal organs. What could be the causes of small for dates? It could be hereditary factors or hereditary predisposition may cause someone to have a small for date child. Then, if there's poor placental function, the baby will not benefit nicely from the nutrients, and they can have small for dates. Long-standing diabetes mellitus also predisposes to small for dates. Mothers who abuse alcohol and narcotics also can have small for dead babies. Okay, so in abusing alcohol, it affects your nutrition and nutrition of the baby. Mothers who smoke, it affects the oxygen that goes to the baby, hence they can have small for death. Then infection of the mother and fetus with rubella and cytomegalovirus or toxoplasmosis may also lead to small for death. So when you have infection, it affects metabolism and baby growth may be affected. What are characteristics of such a child? The child will look wasted. They may look white or pale pink. The length may be greater than 50 centimeters, and head circumference may also be greater than 35 centimeters. Thick dark hair may be seen, and skin looks dry, loose, and thick. Ears, breast tissues, genitalia, they all look mature on examination. There is also good muscle tone. What could be the complications of small for dates? There can be birth asphyxia, and this is due to perinatal hypoxia. This can be also meconium aspiration. This may be due to perinatal hypoxia, actually, which leads to passage of meconium into the amniotic fluid. At birth, the baby can inhale the meconium and can also lead to pneumonitis. The other complication is pulmonary hemorrhage. All right, so the other complication actually that can come in small for death is hypothermia because of large surface area. Then infections in utero like toxoplasma, rubella, cytomegalovirus, and herpes virus. Baby may end up having these infections, and that becomes more of a complication. Hypoglycemia as another complication may result due to lack of storage of glucose during gestation. Because there is infection there, so metabolism is fast, so there will be lack of storage of these glucose because that's been used out by increased metabolic rate during the time of infection. Then there can be congenital abnormalities that may result. All right, so now let's look at large for dates or large for gestational age. By definition, this is a newborn, whether premature, full term, or post mature, who weighs more than normal for the time spent in the uterus. The predisposing factors here also can be hereditary, that is, genetic factors can come at play. Here, diabetic mothers, because of increased glucose levels there, the sugars in the mother, blood may cross the placenta in response to high blood level of glucose in the baby. So the fetus pancreas will then produce a large amount of insulin, that is what we call fetal hyperinsulinism, that occurs as a result of fluctuations in maternal glucose concentration. So the insulin helps in the absorption and conversion of glucose to glycogen and fat. This causes the fetus to grow excessively large. So if the mother does not control her diabetes mellitus or glucose levels, the larger the baby will be. Okay, now let's look at the complications of this. There can be what we call respiratory distress syndrome, or RDS in short. Babies tend to have immature lungs, hence they can have respiratory distress syndrome because when they have immature lungs, the lungs may collapse due to lack of surfactants. All right, then the other condition will be jaundice. This is mainly due to high levels of bilirubin, which occurs as a result of high numbers of red blood cells in infants of diabetic mothers. Okay, the next complication is congenital abnormalities, where there is broader shoulders causing shoulder distortion. And these congenital abnormalities, they happen at birth. So delivery, the baby may be through cesarean section or CS in short. Okay, the next complication is hypoglycemia. Because of hyperinsulinism, the sugars tend to be used and the baby will have low sugars. So the nursing care is the same with the one we learned in prematurity. Okay. So I thank you most sincerely for your concentration on these conditions. Please, if you are not clear, you're free to contact us and suggest a topic where you're still facing challenges so that we can help you. So this was a presentation on small food dates and large food dates, and presentation was done by Mr. Jones. Thank you very much.